Well, yes and no, okay? And there's really a lot of interesting things about that. First of all, the problem we have with a lot of these products, and now, and I want the audience out there not to confuse umbilical cord and embryonic stem cells, totally different animal. Embryonic stem cells are really totally outlawed, and they're very dangerous cells. Now, they come from embryos, aborted embryos, etc. Those are not really used. They've kind of turned out to be a dead end. Now, when you start talking about umbilical cord, placenta stem cells, there's a big problem that you have. When these things are processed, typically most of the cells are going to die.
Right.
So you're not really getting, quote, a stem cell procedure. You may be getting growth factors. There's also, there's a lot of controversy in the field of regulations. FDA is not really too keen on using those cells. So I pretty much have said, you know what, let me look at ways of using the patient's own cells. Because if you're alive and you're healthy, your stem cells are working and they're keeping you healthy. So there's no reason why we can't use those cells. Now, sometimes we've learned ways of kind of coaxing them along. We have some growth factor patches that I'll get into in a little bit and things like that that can make them better. But I'm a big believer in the patient's own stem cells.
Really?
And that's what really makes you work the best.
Okay, well, let's talk about that real quick. When you're using the old, let's just say I'm 65 and I'm coming in with, use an example, with really bad knee degeneration. Let's just say I'm almost bone on bone, almost. Wouldn't it make more sense to use a younger person for that to regenerate quicker than using my old cells, unless if you're able to rejuvenate my old stem cells and turn back the clock?
Well, your old stem cells are not as old as you think, first of all, okay? That's number one. Okay. I mean, the stem cell is not, the same cell you've had for 65 years or 70 years. But remember what I said, when you use those other products, the cells are pretty much dead. Okay. There's not many live cells in those products. So you're not really getting, you're going to get a lot more cells if you use your own than you're going to get using someone else's. Now, there's a couple of other little things that are quite important. One of the things I do is I do a lot of teaching to various docs about the stem cell field. And some of these cells from other sources, from other people, et cetera, they are not what we call immune privilege. What do I mean by that in English? In other words, something that's immune privilege, it means you can inject it in the body and the body's going to accept it and welcome it with open arms. Many of these cells are what we call immune evasive. You can inject them in the body, but they very well may be attacked by the immune system. Eventually, they will be attacked. There's no ifs, ands, or buts about it. The patient's own cells will not. Now, another thing I have to really let you know, most cells, basically, when you inject them in the body, they're not going to last but a few days. Okay, but what they're going to do is, this is what they do. They release something called growth factors, cytokines. Here's a good example of the cytokine right here in my hand. This is the body's cell phone system. Right. This is how the cells communicate with each other. So when the stem cells are injected in an area, they persist for a few days, but they release many of these growth factors, which then summon other cells to go to the area. These cells come typically from the bone marrow, so we have to learn of ways to have the bone marrow produce more cells and things like that. And then they go to the area and help accomplish repair. Now, also, I tell patients, look, stem cells work in two ways. They can hopefully regenerate some of the tissue, but perhaps just as importantly, what they can do is they can change the chemistry of a joint or an area. And what do I mean by that? Well, there's typically, to get a little technical, there's 3 growth factors that cause pain, discomfort, swelling, etc. This is called interleukin 1, interleukin 6, and tumor necrosis factor. The names are kind of complicated, but the stem cells are like little biochemical factories, and they can make growth factors that can basically nullify that effect. And that's what happens. Now, interestingly enough, when you inject stem cells in the body, let's say that we give you your own stem cells or even stem cells from a baby that's been processed the proper way, and you give them intravenously, well, a lot of those cells will end up in your lung, etc. And most of them will perish within a few days, like I say. But interestingly enough, they're replaced by something called a Treg cell. Okay? This is a cell that's found in your immune system. Now, the interesting thing about Treg cells are they're wonderful because they get inflammation down dramatically. Okay, people that have autoimmune diseases like a rheumatoid arthritis or something like that, what's one thing they all have in common? They really don't have enough of these Treg cells. So the immune system and the stem cell world are so tied together. Again, Treg cells seem to be what helps people not get this cytokine storm into COVID-19. This is the people that have to go on ventilators because they're in just such a bad shape. Whereas these Treg cells don't do it. And the nice thing about Treg cells is they last for years. So the stem cells you're putting in here may be lasting a few days, but eventually they get kind of morphed into something else called a Treg cell. So that's why your own cells are not really a big deal, okay? Because they're gonna do their job. They're not gonna be rejected by the body, and they're very safe.
Well, what would you say about? I hear a lot of doctors saying with stem cells that it's continually regenerating. So for me, I'm not a doctor, but I'm thinking, okay, if it's continually regenerating, it's going to where only the inflammation is. How is it continually regenerating without dying? It's almost like I'm thinking like a circuit board. Like, is it just continue to regenerate? Well, is it a half a truth or?
No, that here's the bottom line, and I'll give you some good examples about it. If your stem cells all stopped working, you'd live about 2 days, then you'd perish. Okay, and I'll give you a good practical example. They go to a patient, they say, you know what? You have a leukemia, or they go to another patient, you have a breast cancer. We can maybe cure you, but what we have to do is we have to poison your immune system. We have to get all the immune cells dead and reset everything. Well, the problem with those things are a lot of those people succumb to either infections or bleeding problems. Now, if they can get past that, you know what? They can sometimes cure their disease.
Right.
The stem cells are constantly in motion. They're constantly repairing things. They're constantly replacing things. And yes, indeed, some of them do indeed put more, make more cells of the same type of tissue. Some body tissues aren't as easy to reproduce as other body tissues.
Didn't want to submit to surgery, of course. You don't want to do that if you don't have to, right? And started looking into some alternatives. Stem cells is one. Became an internet expert, if you will, on stem cells after researching it, and enough to know that these clinics that are cropping up all over the place, other doctors I was talking to, they really didn't know what they were talking about. I could tell just by talking to them. After the meeting with Dr. Purita, he spent about an hour with me, answered every question that I had. After talking to him, I called up my fiance, and baby, we don't need to go to Mayo Clinic. The guy's right here in Boca Raton, right down the street from me, which is interesting because people fly in from all over the world to see him, and he's right here for me. But I knew he was the guy after talking to him. We went through the procedure, and at this point I have 90% functionality back in my hip.